My son Kyle was born at just under 24 weeks. He's a surviving twin. He spent, Kyle spent 6.5 months in the NICU. And he came home 2 years on oxygen in the home. And today he's 4.5 years old, and he was recently diagnosed with cerebral palsy. And I say recently because in the past 4 years of his life, we have been through 3 insurance companies. And thank you. I should back up a little bit. We've always had insurance. My husband or myself have always been employed. And when Kyle was born, we were in Springfield, Illinois, visiting family for the holidays. And because he was in the NICU there, I lost my job, and I lost our family insurance. And at that time, we immediately went over to my husband's insurance. We were on mine because I had a better plan. And we switched over to his insurance, expecting everything just to pick up and we could continue to move forward. And we immediately were told that we were out of network and we needed to transfer Kyle. And they really didn't care that much about his condition. They only wanted him stable enough to take a 3-hour ambulance ride up to Chicago. So we did that within 2 weeks. We managed to get him up to a hospital in Aurora. And despite all the communications between the doctors, they weren't able to care for him. So we had to petition for another transfer, and it took 3 days to get him to a hospital that could care for him. And we got him into a higher level NICU, and he was there for 2 more months. So the total time was 3 NICUs over 6.5 months. When Kyle came home, we knew obviously that he had health issues. And we were caring for him the best we could, seeing the doctors we could. But because of the distance of the hospital we were discharged from, we were traveling weekly to the hospital, an hour one way and back. And it just became too much for his care, for specialists, for if he had an emergency, making sure that all of his medical information was located at a central place where doctors could help him. And so we started transferring, went through the troubles of transferring to all new doctors and all new specialists. And about that time, we were told that Kyle needed to see a neurologist, that they suspected that he might have cerebral palsy. And we went on our first wait list. It was 9 months. And after 9 months, the doctor left, and we were put on another wait list, and then our insurance changed, and we were put on another wait list. And then one last time, insurance changed, and we were put on our final wait list. And this past, it was May, he was diagnosed officially with cerebral palsy, something that during that time we were treating him as though we had it through his therapist. But we found out that he had been having seizures. This could have been diagnosed 2 years prior. It would have been diagnosed sooner had we not been put on those wait lists. It would have had the test. It wouldn't have created some of the developmental disabilities that he has today as a result. So we worry about his long-term future, whether he's going to be a burden on other people or merely our responsibility. In the process, our insurance premiums have doubled. Had we not have had our last insurance change, that's probably the one blessing. We would have lost our insurance this summer because we would have reached the lifetime maximum, which is $2 million. So to date, he's billed $2 million in insurance. We average $14,000 out-of-pocket expenses that insurance considers above reasonable and customary charges. We pay $10,000 a year in insurance premiums, actually a little more than that, just to keep our family insured. And none of this covers doctor visits. You know, we go to therapy three times a week, so we're driving constantly. It doesn't cover all of his physical needs for his therapy in-home, special shoes to help him, get around. He goes through them kind of quick. But it's all the little things that it doesn't cover. And we think about what we deal with. You know, we're a fortunate family that we've been able to pay for these expenses. We just have a difficult time planning for his future. And we've met so many families along the way that have stopped coming to therapy because gas prices are high and the insurance rates are going up and they can't afford it anymore. But we make more than the program limits of the Norman State All Kids program outlines, what Division of Specialized Care for Children outlines. But there are families that make more money that can't continue on, because if we were to not sit on those wait lists, our son, we would pay $26,000 a year just for his therapy. We would pay $20,000 a year just for his nutrition and feeding if insurance decided tomorrow that they weren't going to cover that, which, you know, for 6 months of 1 year, we did have to pay out of pocket for all of his care because he has special food needs. He doesn't eat by mouth. And if you were to look at Kyle, he looks like a relatively normal, healthy boy. And it's difficult to explain to so many people why he doesn't talk properly, or he doesn't, maybe he walks differently, why he can't go outside and play like other kids. And it's just, you know, there's all these different things associated with his health that if we could have not been on those wait lists, or if we could have stuck with the same doctors instead of having to switch to someone else, maybe he'd be a little better, just, you know, in one little way. But what we're trying to prevent is anything more happening to him down the road. We want to make sure that he has the care he needs so that he doesn't become a burden of everyone sitting here. That he's able to get a job, that he's able to take care of himself. And that's really what we're looking for. It's just, it's not asking people to help pay our way. We're just, you know, we're willing to do our own. We just need to be able to access the doctors. We need to be able to access the care. We need to be able to, when our doctor tells us you need to go to the specialist, we need to be able to make that phone call and within a reasonable amount of time see that doctor. Because so much can change between that short amount of time when you're talking about children like Kyle. And the one thing that the doctors always told us is that he's a fighter because he's a surviving twin and he shouldn't be today. And he fought. And I owe it to him to fight for him now. I'm so sorry.
What happens when the day comes that she could no longer shell out the types of dollars that she's been shelling out, happily so, on behalf of her son? What happens? Because the insurance premiums have gone up and he's a high risk. That's being discriminated against. He's been placed in a category where he has a pre-existing condition. So we're going to discriminate against Kyle. I don't think so. Not on my watch. You won't. That's the reason why, ladies and gentlemen, we need House Bill 311. We're going to do this.